Hello and welcome to my show. Today we are going to talk about vaginal discharge or vaginal secretions as we call it in medical circles. Many women wonder when they experience certain types of secretions or discharge, whether it is normal or abnormal. So today we are going to look at what is normal, what is abnormal, and that will also benefit you in terms of listening to your body and knowing whether it is okay or you need to see your doctor. Now, what is normal? Having vaginal secretions, or I'd say discharge as we call it out here, is normal, and it depends on the age of the patient, of the woman, if you're in reproductive age or whether it is after menopause. All that changes, and even within the cycle, that is within the menstrual cycle, there are also changes which do occur. And there's the first part of the cycle where there'll be a different type of discharge. There'll be one which will be like light, watery, clear during ovulation, and then there'll be a change again, which it will become more thick thereafter, just before the next period. So all these are usually normal. The common thing with this is it doesn't really have a bad odor, it doesn't smell as such, and there's no associated itch, and there's really no awkward discoloration, so to speak. And then the quantities also do change during the first part of the period or of the cycle, and in between, during ovulation, it actually becomes more quantity-wise, and then it also becomes less just before the period. All this is because of hormonal changes in your body. Now, what is abnormal? How do you know that this is abnormal? What are the red flags, in other words, when you look at the discharge? One is the color. When there is a color which is different from what you're used to, then probably there's an issue which needs to be checked. You're talking about the discharge which is maybe cheesy, cheesy-like, like maziwa mala, such like. That might mean there could be some infection, probably a yeast infection. And if the color also changes to yellowish, more like pus, or there's some streaks of blood, that would be quite abnormal. And it may herald something more serious and needs to be checked. And greenish also would mean there is some infection which needs to be checked also. Now, apart from the color, you're talking about the smell. If there's a foul smell, as you have said previously, that may mean you have a bacterial infection, and there might be an underlying condition which may be encouraging an infection in that particular part of the body. Passing urine and feeling discomfort, that could be also another sign which may be associated with a discharge. And if you look at these types of discharge, we would usually investigate and find out what is causing it, whether it's an infection or whether it is normal or whether there's an underlying issue. And the treatment thereof will usually depend on if there is what the actual underlying diagnosis is. And that is important for you to go and see your doctor so that he could or she could examine the genitals and find out if it's truly an infection or whether it is normal. Sometimes it may not be that worrisome, but when it is there, it's always good to be checked. Now, the treatment will vary, really. It may range from giving antifungals, may range to giving antibiotics, may range to maybe just an advice on lifestyle change, and probably dealing also with underlying contraceptives which somebody may be using, especially the hormonal contraceptives, may also play a part in terms of the type of discharge which is being seen. Some of the discharges may herald, as I've said, a more serious issue, It may sometimes cause infertility. That's why it is important to be checked, especially the bacterial types of discharge. They can cause infertility. And some of them may be maybe a sign that there might be cancer developing, so don't take it lightly. Those are some of the red flags which you should check for. This is Dr. Aurora Maranga, specialist gynecologist and also oncologist. Remember to subscribe and share. This information may help somebody somewhere out here. Thank you.